to ask the question again, how will people know to come here?
Did you put that in the comments?
I did not, I just said that we're gonna get another link point set up.
I just got a notification
That you're live?
Doing an audio check. Can somebody write a comment? Let me know if you can hear me. Okay, I think I am back. And now I've got another cable in my way here. So this is going to be rather interesting to make sure that I don't trip and stumble over it. My apologies for the delay. My computer thought it would be a really good idea to do an update right now. And so that's why things went blank there for a little bit. So we'll try to pick up where we left off. And I'm going to go grab some more questions. So the next question that I have here is distance learning family choice off the table? And the answer to that question is yes. This was mandated by the state last year through the governor's executive orders is really what I should say. And when those executive orders went away, so did that option. So what we are doing is we are looking to engage some interest in an online school, which looks different in terms of it's not a classroom teacher is signing in at the beginning of the day. You're not following the same schedule. And if you go to that survey, you will see some of the major differences that are exhibited that are talked about in the differences between the two. So to answer the question, yes, distance learning family choice is no longer an option. Let me grab another question here. So the next question that's asked here is, so there is a real chance that that COVID positive children can still be in a classroom but without a mask. The answer to that question is yes, it's a possibility that could happen. And that's why we are asking people with the options that are out there, and if you're symptomatic, to look at making the right choice with that there. So yes, that is definitely an option. The next one I have here, if you have multiple kids and one is sick, we don't have to keep the siblings home like last year. That is correct, as long as they are symptom-free. If they get symptoms, we will ask then that you keep them at home. Last year we spent an awful lot of time talking about with our community that we go as the community goes, and that's still going to be true. If numbers stay good in our community, we stand a much better chance. And so again, it boils down to some of the same conversations we're having here, is that if good choices are made, that means we get to keep kids in person, and our numbers will stay low like we want them to be. And so that's why the Safe Learning Plan outlines some of those things, and we are wanting people to make good decisions. And if we see that our data is not supporting our Safe Learning Plan in its current format, then we're going to have to revisit that, and adjustments may need to be made for it. So again, a lot of this will be based upon where our data points are at. So earlier I talked about this idea of what are some of those data points. And so I want to spend a little time talking about that. So what are the data points that we'll be using? So many of them are the same. The one that's different, and I'll start there first, is last year, about this time of the year, the Department of Health came out with a grid. And on there it talked about if your cases per 10,000 divided by the number of people in the 10,000 divided by the number of people in the county times the number of positive cases that you had. If that number was between 0 and 9.99, everybody, elementary, secondary, was in person. And it rolled down by increments of 10 until if you moved beyond 50, everybody had to be in distance learning. And while that was designed to be the number to decide how the school year was going to be opened up, it became a number that a lot of people looked at. And that number is no longer available. It's not out there anymore. So what are we using now is the big question. So we'll be looking at COVID cases for our students and for our staff, just like we did last year. We'll be continually monitoring the spread. We had so little to hardly anything at all with spread, and that again helped us to keep things in person. So we'll be continuing to monitor that. We'll be looking at absences. We're going to be looking at where are the trends at going in our county, in Benton County, active cases. In fact, I want to give a shout out to Benton County Public Health because one of the things that I asked for is when you go to their website and you look at the numbers, and they have it broken down by age categories. They had a 0 to 17 category. And I asked if we could take a look at that and break that down to 0 to 11 and then 12 to 17 or 18, because we know that vaccine availability is different between those two age groups, and they're able to do that. So we'll be able to check and see how we're doing in Benton County. We will also be monitoring what's going on in Stearns County as well. And then I also internally have a chart that I look at to see how some of the school districts around us are doing, and in terms of where their numbers are at. And then the final piece that we will be taking a look at is what we call the Minnesota School Opening Statistics website. And what it does is it does two things. One is it gives a number for the county in terms of what's the transmission rate look like in the county. Last year they used the MDH number, but because that's no longer there, they're using the transmission rate. And if you go to their website, they'll give an explanation. You can also kind of move that to that old MDH number and kind of have a little bit of an idea by dividing it. And I don't remember the exact number. I think it's 5 you got to divide it by, and it kind of gives you an idea of where that's at for those who want to associate with that MDH number. But those are some of the pieces that we're going to be looking at daily to see how we're doing and if our current safe learning plan is meeting the needs of our objectives of keeping students in person and keeping our students and staff safe. So the next question I have here is what are my choices as a parent right now? Is my only option to send my unvaxxed kid to school with others not wearing a mask, or to leave? And my hope is that we will be able to continue to follow our safe learning plan and keep everybody in person and keep our staff and students safe. Is leaving an option? Sure it is. We live in a state where open enrollment options and there are other school options that are available. We certainly don't want to see that happen, but we also understand that parents have choices. That would make me very sad. I had hoped, quite honestly, as we rolled into June last year, that this COVID piece would be more in our rearview mirror. And unfortunately, it is not. And so we have a plan that we put forward. We're going to continue to watch and monitor. And that's my assurance to you, is that if you don't like parts of the plan, I get it, I understand it, but we will constantly be looking at our data And I can assure you, like we did last year, if changes need to be made in order to meet those two objectives, we will do that. But to the question, yes, it certainly is an option that a family could choose. And again, I would hope that that would not happen, but it certainly would, it's parent choice with that. Sorry, I'm kind of taking my time reading this question. It's a little longer. So it says, what caused you to reverse course from your update 2 weeks ago and with the masking guidance of MDH and CDC and MDE? So one of the things that I'll share with you is that we have, as a district, since I've been here, and when it comes time to developing, whether last year it was our learning model and our safe learning